My name is Dr. Aamer Khan, and I'm the co-founder of the Harley Street Skin Clinic with my wife Leslie. We have a cosmetic clinic based in Harley Street, and we see patients with varying needs, anything from basic skin care, skin problems, all the way through to cosmetic surgery. Our philosophy is to get a natural look on everybody, on a woman, on a man. So the way to do that is to carefully assess the patient's features. What are their natural features? How do they look now? And maybe have a look at pictures, how they were 5 years, 10 years ago. Today we're going to be carrying out a procedure on Kit. He has an interesting history in that his wife left him. She was a lot younger than him, told him that he was looking too old. So Kit decided not to lie down and die, and he decided to go ahead and do something about it. He came to see us to see what we could do. Looking at Kit, we considered all the options, including doing nothing, non-surgical, even the intermediate procedures, which were minimally invasive. I felt that the best results for him would be through doing a lower face and neck lift. When people come to us for cosmetic procedures, we've got to be very much aware that there may be a psychological element there. And we've got to be careful not to carry out any procedures unless we know what their expectations are. For the procedure that Kit's having, we should really allow 3 to 4 hours of time in theatre because it's an intricate procedure. It's a very delicate procedure. Kit is awake, it's under local anaesthesia, and the advantage of that is that the surgeon can then move Kit around, look how the symmetry is coming along, and we can get a much better result. In terms of how invasive this surgery is, it's as invasive as any face and neck lift. For an operation like this, typically Kit can expect to have a downtime of about a week, maybe 10 days. He'll have dissolvable sutures in the majority of the places, but there'll be 2 sutures which we would take out after a week. So we'll see him again after a week. It is an open procedure, there's a risk of infection, so he'll be on antibiotics. We're seeing more and more men wanting to improve their looks, and it's partly because of the competition out there at work, partly because people are getting divorced, getting into new relationships, getting into new marriages, having children at a much older age as well. Unlike women, we find that the common procedures for men are blepharoplasties, doing the eyes, doing the noses, lower face and neck. Those are the common procedures, and then after that we see the man boobs, where we get male gynecomastia, increased tissue around the chest. And the most important thing to them is their face. And I suppose they're more reluctant to do surgery on their face because they're afraid that something might go wrong. So they are more likely to have a body procedure done because it can be covered over, and they're not expecting perfection. So I think with better techniques coming in, with better outcomes and results, we're going to see more and more people wanting their faces done.